All right, we're on the home stretch. Thank you for hanging in with us. Please give me some snaps if you had some fun today. How about some snaps if you learned something new today? Very good. Very good. And welcome back, all of you joining us from remote sites. So I'm going to close out the last day today. My name is Tracy Miller, and I'm the Early Childhood Obesity Prevention Specialist for the Prevention Services Division at the Colorado Department of Public Health and Environment. And about 30% of my time is devoted strictly to WICs. So I have an opportunity to work with our state WIC staff and many of you at the local level. So it's been a pleasure over the last couple of years to figure out how to move obesity prevention forward in Colorado WIC. So that's what we're going to talk about today. And many of you have heard me speak about some of these ECOP or Early Childhood Obesity Prevention initiatives before. I've been to some of your local agencies. You've seen me, some of you that are new over the last couple of years have maybe seen me in new employee training and in other venues as well. So a little bit of this information might be a bit of a review for those of you that have heard me already, but I want to be sure to reach every single one of you in all locations across the state with some key information about early childhood obesity prevention initiatives. Pull the mic away from your mouth. Okay. Thank you. Is that better, everyone? All right. Okay, so just a little background on my role at the State Health Department. As I said, only about 30% of my time is with WIC. 50% of my time is with maternal and child health, and about 20% of my time is with some of our CDC Healthy Eating Active Living initiatives. And of course, all of it is focused on early childhood. And when I say early childhood, I'll define that later. But I'm meaning more than just kids, by the way. So we'll talk about that in a bit. But I have an opportunity to coordinate programming among many different programs, many different partners, many different organizations in a collective effort for early childhood obesity prevention in our state. And today we're going to be talking a little bit about consistent messaging, and that's an example of collective effort across the state. So I get to work with a lot of different folks, and WIC is a big part of that, and WIC is a program that's moving forward very quickly in obesity prevention. I'm hoping you can see some of that today. So the objectives here for the next less than an hour, I think I can accomplish this in less than an hour, are first I want to illustrate some of the differences in approaches in obesity prevention. So there's kind of an old approach to obesity prevention and today's approaches. And I'm not talking just about early childhood, I'm talking about obesity prevention for all of our population. Secondly, I want you to be able to walk away to learn what matters most in obesity prevention. So these are our ECOP focus areas for the state, not just for WIC, but all of the partners working in your communities and state and local partners alike are all focusing on some common focus areas, and I want to share those with you so that you can make some sense out of this complex issue. How many of you know that obesity prevention and obesity itself, overweight and obesity is very complex? How many of you agree with me on that one? Okay, so how do we, I remember starting this job thinking, oh my gosh, it's so complex, where on earth do we start targeting our effort? And I'm hoping you can leave with some idea of what matters most so that you can spend the time where it matters when you've got a bunch of choices to choose from. I'd also like to dive in a little bit farther into our 6 early childhood obesity prevention messages. How many of you remember a day, and it was a late Friday afternoon, so you probably saw it on a Monday in early June, a message from me about messages. Does anybody remember that email? No? A couple of you? Okay. Well, I know it went out. So I'm going to talk more about these messages that are intended to be consistently promoted throughout our state. And I'll talk a little bit more about that then. And then finally, I want to touch on our wellness coordinator system that we have going. It's a pilot project that we have in Colorado WIC. And I'm going to share with you what some of the wellness coordinators have been up to. And those of you at remote sites, you're going to have an opportunity to hear from local wellness coordinators that are joining you in your rooms. So there'll be a segment for that as well. So let's talk a little bit about this shift in obesity prevention. And I'm going to cover a shift in approach, a shift in the frames behind that approach. And when I talk about frames, I mean talking about some of those values that are behind it, some of the strategies in these approaches, and what it looks like. And we're also going to see how today's approach is starting to show up and be real in Colorado WIC. So first, focusing on this old approach. This morning, Nora described this beautifully in a small sense. She talked about how in the past information dumping, just telling people what to do and expecting them to change doesn't really work well, right? So that's kind of consistent with this old approach for obesity prevention in a broader sense. And we know that this old approach focuses solely on individual behavior change, that the problem is resulting from if people would just make the right choices for themselves, then this problem wouldn't be here. So that's kind of an old approach, an old thinking about obesity prevention, that it's all about individual change only. And the frame behind that, us in public health and all the work that we do, we're trying to prevent obesity. So in the past, we've done this with the frame of a value of health. I value health, and so should you value health. Well, we don't all value health. I know I do. I know many of you do. But not everybody does. But that's what our approach was based on, is this value of health. And we all want to be healthy, and assuming that everybody wants to do the same. So some of these strategies that describe this old approach are all about telling people what we want them to do, telling them to change their individual behavior. And here's how you do it. And I'm going to dump a bunch of information on you right now, and you're going to learn it, and you're going to go do it. So it's information dumping. It's an old way of doing things. Does anybody remember that who's been around longer? Anybody remember that information dumping? And some of this still happens now. We're still transitioning out of this. And this is not just in WIC. It's in all sectors. So it's an old approach that's pretty widespread across everyone who's involved in obesity prevention and in health. And examples of this old approach is just one-way education, me teaching you, kind of like what I'm doing now actually, me teaching you about what's going on. That's an old approach in counseling. I'm going to tell you what to do. An old approach is non-participant centered goal setting, so setting goals for people rather than people setting their own goals based on internal motivation. And then finally, lectures and mass distribution of written material. So this is all characteristic of a fairly old approach for obesity prevention. So what's today's approaches look like? They're quite different, and I'm sure many of you have recognized this shift. WIC has shifted in this direction, as well as our community partners. Many local initiatives, state initiatives are shifting in this direction. It's all focused on our environment. So our old approach is around individual behavior change, whereas our new approaches are more focused on changing environments to make healthy eating and healthy choices easier. So I think there's been a huge recognition over the past 5 years about our environments and systems that affect our choices. So this is a new approach. It's quite different than individuals. And they're based on different frames. So frames are values. So the new frame, as compared to the old frame of health, a value of health. I value health, and so should you. The new frames are more related to equity, security, and justice. These are common values that the American culture, people that live in our country, tend to value. It's very common. And it crosses many domains of life, including health. So for example, equity is the notion that we all have an equal right to live in a safe place where we can be physically active. We value equal opportunity to do so, I should say. Security is we all value having enough resources to buy healthy food, or to be able to achieve and obtain healthy food. So those are our basic needs to feel secure. And finally, justice is we all have a right. Everyone has a right to a healthy lifestyle, to a healthy environment. That's what kind of is the basis of values behind our approach for obesity prevention today. And so what does that look like? And some of these things are going to resonate that, oh yes, I see that going on in WIC and in other areas where I live, or in our state, or in our towns. And those examples are the strategies. So we've learned a lot today about a different approach for counseling, right? So instead of one-way education, information dumping, more so about using internal motivation, participant-centered counseling, which has been in WIC for a while, but we've taken it to another level today, and you can all practice those skills to another level. And really focusing on some of those root problems that people face that cause them not to be able to do the things that they want to do and that you're telling them to do. So motivational interviewing and health coaching is a great example of a new way of obesity prevention. And then in our environment, we have addressing some of those upstream root causes. So what I mean by upstream is that We're looking upriver at some of those root causes that if we catch them upstream, then we might be less likely for those problems to be farther downstream. If we're working in a non-prevention mode, we're not working upstream. So some of our strategies now are more upstream. It's about changing that environment so that healthy eating and active living are easier choices in the first place. Examples of those are policies and taxes and bans. So things that make policies and other measures that make our environment healthier. Improving sidewalks, improving parks, so that we can be in a safe place and a healthy place to be more active. That's all about environmental change. And then finally, modifications to big systems, such as our food systems. We hear a lot about improvements to our food system. Those are big systems that influence our nutrition and other aspects of our life. So those are the big approaches that we see now for obesity prevention. And what do they look like in WIC? And I've had the opportunity in my job over the last couple of years to watch how this is coming forth in WIC. And it's been moving this way for longer than I've been working in this job. But here's some examples that you'll be able to recognize. Of course, improved counseling methods. That's why we're all here today, and we've already talked plenty about that. What is WIC doing to improve the environment? Farm to family, making healthy choices easier. Linking participants to low-cost physical activity opportunities in communities. And connecting participants with community gardens. Those types of efforts that are improving the environment where our participants work, live, and play. So WIC is there. WIC is grasping onto this new approach. And I just wanted to commend all of you for all of your work in taking on this new approach along with everyone else. And it takes all of us to do this using these a new way of thinking. And finally, community collaboration. To change an environment, what does it take? It takes a village, right? Has anybody heard that? So collaboration is critical. And that's what's happening in communities. And guess who's part of those community collaborations? Who is it? It's WIC. WIC is a big part of that, and I'm seeing it more and more. So this is a great new approach, and WIC is a part of it, and it's going to get even better. So what I'm going to do now is I mentioned that I wanted you all to leave with some key focus areas that Colorado WIC, collectively, all of us collaborating together, are focusing on to address early childhood obesity. So let's start with a little quiz, and those of you who've seen this before, I'm not sure if I've done this before with you, but you might know the answers if you've heard me speak about this before. So you can cheat, it's okay. So the first question. We've got 3 factors up here, and all of them are related to obesity. You know, this is complex, lots of factors, right? There's a huge long list of factors for obesity. And I want you to tell me, according to the most recent research, which of the following factors is most strongly linked with obesity in early childhood? A is inadequate fruit and vegetable consumption. B is duration of sleep. And C is excessive juice consumption. So how many of you think A, which is inadequate fruit and vegetable consumption? Raise your hand. Okay, couple. How about B, duration of sleep? Couple. Some of you aren't raising hands, so everybody else is going to raise on C, right? Excessive juice consumption. Wow, so all these are really important. They're important factors, but which one's the most important? The answer is duration of sleep is a very strong factor. Out of those 3, it's what is currently, according to the most recent literature, is one of the strongest factors out of those 3 that's linked to overweight and obesity risk in young children. So cool, huh? Very interesting. Here's another one. Out of these 3, this is another set of 3. All of them are linked in some way. According to the most recent research, which of the following factors is most strongly linked with obesity in early childhood? Is it attendance in childcare, is letter A. B is maternal BMI, so body mass index before pregnancy. And smoking during pregnancy. How many of you think A, attendance in childcare? Nobody, okay. B, maternal BMI. Okay, quite a few of you. And how about C, smoking during pregnancy? Okay, all of you who raised your hand are correct. Maternal body mass index is one of the strongest factors of all 25 factors that we looked at that's linked to early childhood overweight and obesity risk. So that got your mind directed to what we're going to talk about next. We're going to look at the whole list of things that we've pared down to identify as focus areas in Colorado for ECOP initiatives, Early Childhood Obesity Prevention. So first I'm going to mention what I started to say earlier about what I mean when I say early childhood obesity prevention. I don't just mean about the kids, okay? I mean, just one of the questions we had, who do you think I'm caring about here? Mom. Shout it out. Mom, I'm thinking about mom. And mom in a couple phases of the life course. We have prior to pregnancy. That's a distinct phase in the life course. It could be interconception between pregnancies. So when I say early childhood obesity prevention, I'm talking about preconception, prenatal, during pregnancy, those factors that pregnant mothers are exposed to. Infancy, infants matter, they really do. And popular belief over the past has been like, oh, the baby will just outgrow baby fat. Not a problem, and it matters now, it really does, and evidence is finally showing that. And then, of course, early childhood under the age of 5, which includes infancy, actually. So 4 phases of the life course are critical in addressing this issue. And so we'll see in the next frame that I have a list of factors that have been identified as focus areas, and they cover all of those phases of the life course. So the first 2, pre-pregnancy BMI and appropriate gestational weight gain, those are important factors, and they're among the strongest of these listed up here. Very strong factors. And maternal BMI that is too high and gestational weight gain that is too high are strong factors. So why is this? It's a combination of a few theories behind this strong relationship. Of course, we've got genetic disposition, that's part of it. Secondly, we have a shared set of environmental exposures. So in utero, mom with baby, unborn child, they're exposed to that same environment of lifestyle factors, physical activity levels, as well as nutrition. So that similar exposure. And after baby's born, in those first early years of life, mom and child are exposed to those same factors. And mixed with, probably in synergy, a third theory around a notion or a theory called metabolic programming of the infant. So the infant is exposed as the infant is in the prenatal phase, the infant is exposed to altered metabolic processes in the mother. And the infant's body and metabolism begins to shape that way as well, and which is predisposing or pre-programming to obesity and overweight in the child. So mom matters a lot before and during pregnancy, because that environment that that child is in utero, the theory is that it's impacting the way that child's metabolism functions. And it's way more complex of a story than that, but that's just where I'll leave it at for this. It's pre-programming of metabolism. And then next we have infant feeding practices. So I mentioned that infants really do matter. And a fairly strong factor is responsive feeding. And Nora talked about that a little bit this morning in an example around recognizing cues of hunger and satiety in infants. So it's a very not as strong as pre-pregnancy BMI, but a fairly strong factor. Unresponsive feeding is a fairly strong factor for obesity risk in the young child. And then we have sleep duration. Shorter sleep duration means higher risk of obesity and overweight, and that's mainly due to hormonal responses that regulate growth and appetite that happen during sleep. So sleep is really important for children and adults alike. Screen time, we know the toxic combination of sedentary behavior when children are sitting in front of the screen, a lot of calorie consumption, and also advertising to unhealthy foods during commercials and other avenues in television watching. So screen time is an important factor we're focusing on. Physical activity, we've heard all about that today. Thanks, Darlene.
Thank you.
Breastfeeding is protective. It's an important factor that we include in these areas of focus. And finally, nutrition is an important part of the equation. However, on the nutrition side, we have very little evidence to point at one component of nutrition. There's some that speaks to sugar-sweetened beverages, of course, which one of our messages is focused on. But there's really nothing that really stands out that's as strong as some of these other factors in the area of nutrition. But it is part of our equation, and it is a focus area for ECOP. So I'd like to ask you this about your work that you do. And out of this list, how many of you think that you have the power or the opportunity to impact at least half of these factors? How about all of these factors? You seeing connections with your work? So WIC is one of the unique programs that has an opportunity, because of the populations you serve and the periods of the life course that you impact, to address all of these factors. And there's really no other program that truly has the ability to do that, because other programs focus on certain phases of the life course, but WIC focuses on all of them. So it's very unique and a very powerful component to this solution. So we have a lot of opportunity, a lot of work to do, and a lot of work to continue, I should say, because WIC is obesity prevention, what we're doing now. You'll see that in this document the target audience is identified, and then there's a list of supporting points. So the main message is good material for us to do material development. So it's the main message that would be with an image. The supporting points are for counseling. So the idea is that the message would really help stimulate conversation. And what do you say to follow up with this message? What's the supporting information to support it? So I just wanted to make that clear, that you've got a main message and supporting points to that. So let's start with the first one. This one is targeted to pregnant women, and it reads, healthy eating and staying active while you are pregnant matters for you and your baby's health. So what our focus group said about this message was that it was a good message and it was effective. And they suggested additional information to support the message in a positive manner, always focusing on what to do rather than what not to do. So that's really connected to what we were talking about this morning, all around positive talk. And the focus groups really believed that they needed some supporting content for that. And also, they wanted to know the good results for mom and baby. Why does this matter? Not all women can make this connection between their activity, their health during pregnancy, and much less the health of their baby, and why this matters. So the supporting points regard why this is important, why gaining just the right amount of weight is important, and how physical activity and nutrition are connected to that. And I'm not going to read these slides here. I'm just kind of pointing out, the content here. This is what is in the supporting points, and I'll just describe what it contains. It also includes some examples of what we mean by a healthy diet and what we mean by staying active. And of course, for each one of these messages, you could write a book. There's lots of things that we know make up a healthy diet. But these are just enough examples so that people get the idea of what we mean by a healthy diet and what we mean by staying active during pregnancy. And there's also a piece on there about talking to the healthcare provider whenever to begin a physical activity plan or a program. So we always have to put that in there for safety for this particular message. So this one's all about pregnancy. There is another message that's not one of these 6 that's about the right amount of weight, gaining just the right amount of weight. That'll be a message that we roll out next year. And it's connected to this message. This is around the healthy eating, active living, but the other one is around why it is a little more on gaining an appropriate amount of weight during pregnancy, which you all talk about anyways in your visits. So the next message is a breastfeeding message, and it's an exclusive breastfeeding message. So we know that we're pretty successful in Colorado in helping mothers breastfeed and getting them started. But what we're focusing on now is that exclusive breastfeeding for the first 6 months. So that's what this message is about. And the main message is give yourself and your baby all the benefits of breastfeeding. Doctors recommend for the first 6 months, feed your baby only breast milk, even if it's offered by a bottle. Aim to continue breastfeeding while offering solid foods until your baby's at least 1 year or older. So most of our focus groups, this was pregnant women as well as new moms. They haven't had an overall agreement with the intent of the message to promote breastfeeding, but also gave us some recommendations from the original message. We did some wording changes based on the recommendation to try to use a little different word choice to reduce possible feelings of guilt among women. So we did that. We changed a little bit of a word choice to make that, to meet that need. And there was also some confusion the way the original message was written about the length of time that women should breastfeed. So we brought some clarity to that as the message was rewritten. They also wanted to know what the other benefits of exclusive breastfeeding are. So it's not just limited to overweight and obesity prevention, but some of the other benefits of exclusive breastfeeding specifically. And then also we listed some in the supporting points. We listed some community resources in Colorado that moms could connect to for breastfeeding support. So of course in the supporting points we incorporated all of that as recommended by the focus group participants. And by the way, our focus group participants were mostly WIC participants. So that's who we determined was our target audience, and many WIC agencies across the state, thanks to all of you, were helped in recruitment and in some cases hosting these focus groups. So this is your population that's giving this feedback that you work with every day. So the next message is the message that Nora talked about this morning. So she demonstrated how you can bring in some of these ECOP messages into the counseling process. And this is a parent power message that she spoke about this morning. So originally this message was simply mom power. It was, there's no power like mom power. So it was only tested with focus groups of mothers of very young children. And overall that group really felt that it was empowering and concise. They recommended the addition of the benefits. Why? What is this connection between me taking care of myself and what does it mean for my child? And so we included that in the supporting points about what we mean by taking care of yourself, first of all, and what are the benefits of this, and what it means for you, yourself, and for your child, and even for your next child, planned or unplanned. So really this is an interconception health message for moms, but we did go ahead and write parent power due to some large stakeholder discussions in the revision process, and really felt like we needed to be inclusive of those caregivers, besides mom as well, because all caregivers, dads, grandparents, child care providers alike, are all role models for young children. If you feel like you need to, like if you're speaking with a mom and you want to tailor this message, or if you have a group of moms you're working with, if you want to use mom power, that's okay. Feel free to do that. Okay. So message number 4 is rethink your drink. And this is a message that has been used in quite a few local WIC agencies already. And so we ended up testing this message. It hadn't been tested before in Colorado. It had been tested elsewhere in our country, but not here. So we went ahead and tested it to make sure it resonated with our population. And it did. Our focus groups really felt that the message was simple and to the point. It did recommend some additional suggestions of how to make water more tasty and instructions of how much water should be consumed daily, which was kind of difficult because it does vary by activity level and body size. So we just put in a statement about that and made that revision. So certainly our supporting points for this message include those suggestions. And this one is one also that Nora alluded to a little bit this morning about responsive feeding. Trust your baby to know how much he needs to eat. Your baby will show you signals of hunger and fullness and will trust you to respond. So this message also tested well, and as a matter of fact, this message was unchanged because it did test so well with our focus groups. They felt it was effective and a very important reminder, and it's clearly for parents and caregivers of infants. So this is strictly a caregiver of infant message, and that caused some confusion in our focus groups, but that was definitely the conclusion out of this. But I also want to mention that the concept here does extend to our preschool-age children, and what is that? It's a division of responsibility that adults choose what to serve and when to serve, and children have the responsibility to choose if and how much to eat. So it's the same concept, but this message is strictly for parents of infants. This factor, if you recall, is one of our strong factors for early childhood obesity prevention, one of our focus areas. So in the supporting content, we have just a little bit about what it looks like to be hungry and for an infant to be hungry and full potentially? What are those early signs? We want them to catch signs early. But it also can stimulate a conversation around all those other little signs that infants give us that maybe don't mean that the infant's hungry, but maybe tired or need a diaper change or a change in routine. So I know that those conversations that you have often, and this message can help support that. And the last message of the 6 is, this is a broad message around healthy eating and active lifestyles. Give your child nutritious food and active play for a healthy future. So this is interesting because the focus groups had some interesting responses to the original message, which was different. So listen to how the original message read. It read, give your child or grandchild gifts for a bright future, healthy foods and active play. So grandparents and mothers thought this was okay, the original message, but fathers really had some mixed impressions about this. Mothers and fathers both suggested to move healthy foods and active play to the beginning of the statement and de-emphasize that word of gifts. We ended up getting rid of the word gifts. And fathers who participated in focus groups noted that really a bright future cannot necessarily be guaranteed by a healthy lifestyle, and some of our stakeholders also felt that way as well. And so that prompted another revision to the message. So there's quite a bit of discussion around this one. And it's interesting because if these messages provoke a lot of discussion, it means that we're hitting the right concepts, you know. And if it's an old topic that nobody thinks about, then it's an old topic and it's not very interesting or motivating. But this is one, for example, that really generated a lot of discussion. So this is how it ended up reading. And then, of course, the supporting points include what we mean by healthy eating and active living. And of course, it's not the exhaustive list of all the things we know about, but it's a starting point to give some examples. And it's a starting point for conversations for all of you, for healthcare providers and others who work with families, and especially in the context of appreciative inquiry like Nora spoke about this morning. So you've had a full orientation to the 6 messages, and they are available for your use. The next step here at our state office is that we're going to be planning the creation of materials to accompany these messages. Unfortunately, I couldn't scrape together enough money to test these messages with images. We're going to be trying to think through that and figure out what types of materials would be helpful to reinforce these messages in Colorado WIC. So that's the next step. But these are certainly messages, given the skills that you've learned this morning. You can start using them and practicing them. And the hope is that you will all be doing this, as well as your community partners and other state partners to deliver consistent messages. So are there any questions either online or here in the room about the messages or the process or anything like that?
Did you mention that the focus group?
I'm sorry?
Did you mention that the focus group was towards only the WIC participants, including families?
The question was whether the focus groups were targeted towards the WIC participants and their families. I believe the focus groups, the criteria was that all of them were low-income families, but many of them were recruited by the WIC offices. I can't say that 100% of them were WIC participants. Of course, the grandparents probably weren't, but they all had a criteria that they were low-income families. But probably not 100%, but a very good proportion of them. Some of the focus groups were held in WIC offices, and participants were recruited from those clinics. Any other questions? And I'd also like to add that we're going to host the focus groups research report. If anyone's interested, it's quite a nice report that our contractor completed with all the details of the methodology, the results, the analysis, if any of you are interested in looking at that. All right, so just a wrap around to what we learned this morning. What we're trying to do, what Nora was trying to teach you this morning, is how to plant these messages in fertile ground so they can grow like a seed. And her techniques this morning really prepares moms to be able to listen. And when you have that transformation, when you have that confidence, you can bring these messages in so that they can be acted upon. And you can help participants remember those past and present successes so that they can really take your message in and move forward with it. So that's your task, is to begin practicing that, using those cards that Linda developed and Nora, and I hope these messages can come to life. And you're part of a bigger, everybody's got a role in this. WIC, as well as healthcare providers and local public health agencies, we're all working together. So hope you can join us on that. So what I'd like to do now is end the little discussion here with a wellness coordinator update. And first what I'm going to do is describe what this wellness coordinator system is, because we've been piloting it since April, and it's a year-long pilot. And then we're going to hear from those of you at remote sites. You're going to hear from wellness coordinators that are present with you, and here at Denver WIC, and also I just wanted to mention that Pueblo. Those of you listening from Pueblo, you're going to stay with me here when we get to that point, and I'm going to share what the local WIC agency wellness coordinators have logged as their activities, so you can get an idea of what life as a wellness coordinator is like. So first, a description of the wellness coordinator system. It's a system of learning and collaboration among local WIC agencies as well as the state office around how to advance early childhood obesity prevention and WIC. And there's some specific objectives that I'll describe about this system that I'm hoping we'll see some movement toward as we continue the pilot over this first year. So one of those objectives is that we have a designated local agency, early childhood obesity prevention and wellness expert at local agencies. And during the pilot, we've got 10 local agencies that have one or more wellness coordinators. We have 16 total wellness coordinators. So the role of those wellness coordinators is well defined, and one of them is around training. So I've done a little bit of training with the wellness coordinators to bring them up to speed on some of these things I'm talking to you about around the key focus areas for ECOP and some of the concepts around early childhood obesity prevention that we need to think about. But then also the wellness coordinator's role is to train staff at the local agency. So put on events, join staff meetings, and present some of this information. It's an avenue of communication among all of us and a sharing of ideas. And we hope that the wellness coordinators fulfill their role of coordinating wellness activities for families and staff alike. So participants and worksite wellness. So focusing on the health of our own staff. And then finally, the last role is all around state and local partnerships. So a big chunk of my job is working with state level partners in moving this effort forward. So the local wellness coordinators also have that role of, where possible and if capacity is there, to strengthen those community partnerships. So WIC is part of this movement to improve the environment where families live. See, when they leave your office, we want their environment to be healthier so that they can actually do some of the things that you're hoping they'll do and meet their goals. So here's the Colorado WIC wellness coordinators. There's 10 local agencies, and I've listed out the names of all the wellness coordinators in the current pilot. And I just want to thank all of you who are wellness coordinators for participating in the calls and carrying out the activities and sharing ideas and having great discussions on those calls. So at this point, I want all of the wellness coordinators. So at Sunrise, if you want to turn your volume down, and at Mesa, if you want to turn your volumes down, you'll have a wellness coordinator at your site that is ready to share experiences and what life is like as a wellness coordinator. And then when your discussion is over, feel free to come back to the live site here, and I'm just going to be sharing with the group here as well as in Pueblo. Pueblo, if you want to stay online with me, I'll share a little bit about what the wellness coordinators have been up to. So what we have going on is the wellness coordinators are keeping logs, and this is for my evaluation purposes. I've created an evaluation plan of this pilot with some distinct short-term outcomes, and I'm hoping after this pilot is over that I'll be able to determine our progress towards those outcomes. And part of that is some data collection, and so the wellness coordinators have been very willing to log some of their efforts, and I want to share with all of you what they've been up to. So of course we've had conference calls about every 6 weeks, Of course, we've had conference calls about every 6 weeks, and those conference calls are all about sharing ideas and learning and a great discussion. So all of the wellness coordinators have been participating in that. Particularly, our first topic is that we focused on is sleep. So we know how much interest that that stimulates, and we sure had some good conversations about it. So many of our wellness coordinators have trained their staff on the importance of sleep and why it matters and why maybe we should start talking to families about sleep. And many have done so. So many local agency staff have started kind of added a question onto the nutrition interview about, well, how is your child sleeping? And they've really been pleased with the response from families. It's a topic that parents can talk about without any hesitation and without nervousness, and contrary to the topic that Nora talked about earlier around the growth charts, sleep's a little easier to talk about than that. So it's definitely been a topic that they've been able to talk about, and it's also stimulated some thinking about staff's own sleep behaviors. Like, I know I need to get more sleep. I realize that sleep's important. So we've talked about that on the wellness coordinator calls. So there's been some creation and use of sleep materials for staff to use with families, and the group has shared that. All of these materials and resources, by the way, are on the Colorado WIC website. What heading are they under, Linda? I think it's under wellness.
Yeah.
Oh, early childhood obesity prevention, and then there's going to be a wellness coordinator. There's a wellness coordinator tab, and all the materials that we talk about and share with each other are available there. So sleep has been the one that we've focused on since we started. We've had some wellness coordinators start some worksite wellness strategies around walking groups and other activities. And then also some community partnerships. We've had, I think this one wellness coordinator has collaborated with some of the community partners around sleep, around the importance of sleep, and what are you doing in your materials with your families? We're doing this, maybe we can all do the same thing for that consistency. So that's certainly what we've seen so far with the wellness coordinator system. And it doesn't seem that it's taking too much time. I know that different agencies have different availability as far as time. But I've heard from a couple of them that there's really not a whole lot of barriers to participating, and that's one thing we're trying to find out about a system like this. So are there any questions about the wellness coordinator system, either online if you type those in, or here in the room? Okay, so I just want to see, do you know if anybody, how long we've been talking?
Yeah, but give them a couple more seconds to hear that question.
Okay. Oh, yes. Okay. Fortunately, 2 of the sites have wellness coordinators, so I'm sure they're asking questions directly of them if that's the case. But what we're going to do next, unless we get a question, is we are at the end of our day. Yay, you've all survived the training, and I hope you had a really good time. And I'll have a closing here in just a moment. So if you want to take a quick breather while we wait for everybody else to get back on. All right, so we don't have any questions from the field. So I'll go ahead and wrap up with a couple of final comments. On the behalf of Colorado WIC, we hope that you found today's training fresh and inspiring. And I know that you all have many skills to practice and put into play, and some tools to do so. You've got some messages to work with. You've got some strategies to work with. And I want to thank all of you, those of you who have joined us from remote sites as well as here in the room. Thank you for participating, for having fun and laughing and doing laughing for your own good health. That's always good. And it's been fun to watch you. So what I'd like to also mention is that our Colorado WIC State Office Nutrition Unit are going to be exploring how to incorporate this information into some core activities, such as existing WIC materials or any that are developed in the future, new employee trainings, etc. So all of the materials from this training will be on the website. There's a tab there for this training, and you can access that if you're missing anything. I'm not doing that, I promise. Who's doing that? That's okay. So please, a reminder to go online and fill out the evaluation survey. You can scan the QR code with your smartphone or wait for an email from Linda with the link to that survey. And I wish you safe travels home wherever you are and wherever you need to go today. And I want to say thank you. It's been a pleasure to be with you all. And thank you to Melissa for hosting the live site here. Much appreciated. So have a great day. Thank you.